Hello, listeners. Welcome to the IssueWire podcast. And today's podcast is about Dr. Maya GPT, revolutionizing healthcare, reducing inequality, and protecting against pandemics in the age of technology and rapid expert system innovations. Healthcare is on the edge of a transformation. At the heart of this makeover is Dr. Maya GPT, an AI-driven healthcare aid created by Dr. Kadiyali Srivatsa, a visionary determined to link gaps in healthcare, gain access to, reduce social inequalities, and empower individuals to take control of their wellness. With a deep understanding of clinical expertise and a concentration on ease of access, Dr. Maya GPT is poised to change how we detect, deal with, and stop diseases, ushering in a future where healthcare is much more accessible, fair, and responsive. The vision behind Dr. Srivatsa's Maya GPT started with a worthy reason: to deal with the growing difference in healthcare systems, especially in underserved areas, and creating nations. Access to prompt, accurate, and inexpensive medical care is an everyday obstacle. Whether due to a lack of physicians, long waiting times, or the high price of assessments, millions experience silence, usually delaying therapy until their conditions get worse. Dr. Maya GPT aims to remove these barriers by supplying free, accurate, and instant medical care details to anyone with a smart device. With her extensive clinical knowledge, which draws upon the latest books, research studies, and scientific standards, Dr. Maya offers customers an individualized, symptom-based consultation. Users must download the application, define their signs and symptoms, and get tailored details on prospective medical diagnoses, therapy choices, and next steps. Minimizing inequalities in medical care. Among the most transformative facets of Dr. Maya's GPT is her capacity to reduce social inequalities in medical care. Traditionally, top quality treatment has been an advantage, typically depending on elements like socioeconomic condition, geographical place, and access to insurance. Dr. Maya eliminates these boundaries by offering instant, free clinical suggestions to those requiring them most. Imagine a child in a remote town experiencing a fever or an older adult in a shanty town battling with breathlessness. With Dr. Maya, these people can receive immediate guidance on whether their symptoms point to a severe condition requiring urgent clinical interest or if their ailment is most likely to settle independently. This is particularly important in areas where medical resources are scarce and healthcare providers are loaded down. By encouraging people with understanding, Dr. Maya levels the playing field, ensuring nobody is left behind, no matter their history or economic standing. This service allows equitable accessibility to healthcare and assists in protecting against unneeded fatalities and suffering. Identifying adults and children suffering in silence. Dr. Maya GPT is a groundbreaking tool designed to identify and support adults and children who have experienced physical, emotional, mental, or sexual abuse. By leveraging advanced AI capabilities, Dr. Maya GPT can sensitively analyze inputs such as reported symptoms, behavioral patterns, and narratives shared by users. It provides an anonymous, non-judgmental platform where individuals feel safe to express their concerns. The system generates personalized recommendations, linking individuals to appropriate services for counseling, medical care, or legal support. By collaborating with agencies and NGOs, Dr. Maya GPT can centralize efforts, streamline helplines, and ensure continuous tracking of at-risk individuals, offering holistic and trauma-informed assistance. This innovation can revolutionize support systems, making help more accessible and personalized for those in need. Preventing pandemics with positive detection. One of the most essential benefits of Dr. Maya's GPT is her capacity to stop pandemics. Past episodes, such as COVID-19, have shown how swiftly an infectious disease can spread across borders, overwhelming medical care systems and causing extensive panic. Among the essential factors for such rapid transmission is the delay in recognizing signs. leading to people unwittingly contaminating others. In feedback, Dr. Maya created color-coded symptom lists to help individuals swiftly determine whether they might be infected with a transmittable health problem. By asking individuals to report just 2 or 3 signs, the system can help determine the possibility of a severe disease, such as influenza, COVID-19, or other transmittable illnesses, and advise isolation to secure relatives. This easy yet highly effective tool lowers wasted examinations and ensures timely isolation and treatment. For example, if an individual reports signs and symptoms like fever and fatigue, Dr. Maya can suggest that they may have a viral infection while encouraging them to take the following steps: looking to launch treatment or isolating to stop the spread of the illness. This early detection can help avoid neighborhood outbreaks and conserve countless lives by lessening the holdup between sign start and diagnosis. Addressing worry and stress and anxiety. Dominating the unknown, one of the most considerable obstacles encountered by individuals when they experience signs is anxiety and stress. The unknown can be distressing, particularly regarding wellness, whether the worry of getting an illness or simply not recognizing the intensity of one's signs and symptoms and physical condition. By offering customers trusted, evidence-based details, Dr. Maya helps clients understand their signs and symptoms, discover more about their conditions, and confidently navigate their subsequent actions. People can empower themselves with expertise rather than waiting in worry and uncertainty. With Dr. Maya, individuals are no longer overwhelmed by the unidentified. They can also review their searching doctors, cultivating better communication and collective decision-making. Detecting and dealing with clinical worries without the consistent fear of misdiagnosis or inaccessibility enables people to regain control of their health and wellness, lowering unneeded tension and bringing about much better outcomes. A universal option for all. One of the most impressive aspects of Dr. Maya is universal accessibility, which is a language users can understand. Whether you are a millionaire with a personal doctor or a laborer in the backwoods, Dr. Maya deals with equal care. Unlike traditional healthcare systems typically fragmented by socioeconomic variables, Dr. Maya supplies free access to anybody with a smart device, making it the utmost equalizer in healthcare. This is a tool for the masses, a sign of the future of healthcare. Picture a future where any person, despite income, can access prompt, reputable clinical guidance without navigating complicated insurance policy systems, long wait times, or monetary barriers. This is the future Dr. Maya GPT offers, a future where medical care is a right, not a privilege. Getting over the obstacles. The journey to Dr. Maya. The road to developing Dr. Maya was not without its difficulties. As Dr. Srivatsa functioned tirelessly to create the system, the challenge was creating a system that was clinically precise and easy enough for everybody to use, despite their medical understanding. However, Dr. Maya's drive is based on the idea that nobody needs to endure in silence. Every discomfort, every tear lost by people, rich and inadequate alike, was the driving pressure behind this noble cause. Dr. Maya was created with a vision to reduce discomfort and suffering without price, regardless of who you are or where you originate from. A Nobel cause for future generations. Dr. Maya GPT's vision is more than just medical care, creating a globe where future generations can live much healthier, happier lives. By providing equitable, timely, and precise medical care information, Dr. Maya can catalyze a makeover in which location or range no longer determines health and wellness. It is a call to action for all of us to accept the future of healthcare and get the word out. Share this modern technology with those who require it most, because together, we can make healthcare a universal right, bringing hope and healing to all. Thanks for listening to the Issue Wire podcast.